and welcome to Health Matters. My name is Kelly Morris, and I'm with Alberta Health Services. Thank you for joining us for today's episode. We've got an exciting lineup of speakers for you today, featuring Alberta Health Services interns and trainees talking about topics to get us ready for summer. We'll be chatting with Alan Asplund, an environmental public health trainee, talking to us about beach water sampling. Up next, we have Zareena Khan, another trainee with environmental public health, who will talk to us about West Nile virus and how to reduce our risk of exposure. Then we'll talk about nutrition for our littles, discussing what influences children's food choices with dietetic intern Mariana Feijoo. First up, I'm joined today by Alan Asplund. Alan is a trainee with Environmental Public Health, here to explain more about beach water quality testing in Southern Alberta. Alan, why is it important to monitor beach water quality in Alberta?
Well, Kelly, beach water can become polluted and beach water quality can change over the course of the summer. Weather events and elevated water temperature can cause pollutants in the water to rise to unhealthy levels.
What are some of the illnesses related to contaminated beach water?
In general, illnesses linked with contact to contaminated beach water can include irritations and infections of the ear, nose, throat, and skin, as well as gastrointestinal illnesses.
So, how does the beach sampling program work?
Alberta Health Services coordinates sampling activities in partnership with the operators of those beaches that have been deemed a priority. Samples are collected from late May until early September. AHS provides the sampling materials and access to laboratory testing services, while the beach operator is responsible for collecting the samples. The beach operator is also responsible for developing a safety plan for their site.
What exactly do you sample for?
Most beaches are monitored for Enterococcus bacteria. These bacteria are associated with animal or human fecal contamination, which can cause illness. Some beaches are also monitored for cyanobacteria, which is also known as blue-green algae. This type of algae can produce a dangerous toxin that is harmful to humans and animals.
How is the public warned that a beach is not safe to use?
When a beach is deemed unsafe, an advisory will be put into effect for that site. Signage is posted at these locations, and advisories are also posted on our Alberta Health Services website. Some beaches with a history of poor water quality may be permanently posted with signage.
Thanks, Alan. That's all great information. For more information on water advisories and other health advisories from Alberta Health Services, visit our website at ahs.ca, click on News, then Active Health Advisories. We'll be right back. Welcome back to Health Matters. Joining me now is Mariana Feijoo, dietetic intern with Alberta Health Services, to speak about food marketing to children. Thanks for joining us, Mariana. What influences children's food choices?
Children's food choices are affected by many factors, such as culture, religion, and food availability. Parents and caregivers play a significant role in children's food choices. But another key factor are food environments, including marketing of food and beverages. Food marketing attracts children's attention, influences their food choices, and prompts them to buy products. Research has shown that children see approximately 1,500 ads on social media every year, and over 90% of food and beverage advertisements are for non-health promoting highly processed products. These can contribute to excess consumption of sugar, saturated fat, and sodium. Kids are a period for developing lifelong eating habits, and this can pose a risk.
So why are children vulnerable to food marketing?
So children are vulnerable to food marketing due to three main reasons. First, they are an easily accessible audience. They see advertisement in many different places, such as online, in grocery stores, in recreation centers, on television, and at school. Second, they are constantly targeted through various appealing ways. For example, using cartoon characters and food packages, given toys with the purchase of a food product or a fast food meals, and being exposed to advertising on online games or videos. And lastly, due to their developmental stage, they are more easily influenced. Children can be easily manipulated by advertising. In fact, children who are 8 years old or younger have difficulty differentiating commercials from regular TV programs.
Are there any current advertising regulations?
So currently, the Canadian Children's Food and Beverage Advertising Initiative, or CAI, is a voluntary measure led by Canadian food and beverage companies. The 16 participating companies have committed to changing their marketing directed to children under 12 years of age to promote healthier food and beverage options, or to not advertise to children at all. However, the amount and nutrition quality of food advertisement targeted at children has not improved since the initiative began. For example, a study conducted by Dr. Padbit Kent showed that 3/4 of the unhealthy ads viewed by children and youth were from companies that participated in the CAI.
So what would be some effective regulations to limit unhealthy food marketing to children?
Regulations of food marketing to children can assist in preventing unhealthy foods from being promoted to youth. Some successful examples of regulations can be observed in the province of Quebec. Quebec has implemented regulations since 1980 to prohibit food marketing and other marketing to children under the age of 13. This legislation has been proven successful and linked to a 13% decrease in fast food purchases. As well, Quebec has the highest fruit and vegetable consumption and the lowest obesity rate in children aged 6 to 11 years.
What are some strategies to limit children's exposure to food marketing?
So Canada's Food Guide recommends the following strategies to lessen children's exposure to ads. First, restrict screen time. Many advertisements are on TV, social media, and online games. Another option could be to use ad-free platforms or download a software that limits advertising and pop-ups. Second, talk to kids about limiting what information they disclose on the internet. Explain that sharing information can lead to receiving targeted ads. Third, encourage schools to avoid the marketing and selling of ultra-processed foods and beverages. And lastly, educate children about food marketing. Teach them how to spot marketing strategies and how to select products based on food labels rather than just advertisement.
This is all great information, especially as we head into summer vacation and all the extra treats that come along with it. Thanks for sharing with us today, Mariana. We'll be right back on Health Matters. Welcome back to Health Matters. I'm now joined by Zareena Khan, an environmental public health trainee with Alberta Health Services. With summer and water comes mosquitoes. One risk with mosquito bites is West Nile virus. Zareena, what can you tell us about West Nile virus? What is it?
Well, West Nile virus is a virus that is carried by some mosquitoes, which can become infected after feeding on birds and animals that are infected with the West Nile virus. So if you're bitten by a mosquito carrying the West Nile virus, you can also become infected.
What are the symptoms of a West Nile infection?
Some symptoms include general symptoms such as fever, chills, nausea, headache, rash, and fatigue. But you can also have a neurological syndrome with symptoms such as muscle weakness, tremors, convulsions, and seizures. And in some instances, the virus can be deadly.
Who is at risk of a West Nile virus infection and when?
All Albertans are at risk. Where there's mosquitoes, there's a risk of infection. The mosquitoes are prevalent during months of July and August when temperatures are high. So it's important to take precautions during that time.
So what precautions can you take to protect yourself from West Nile virus?
Some precautions you can take include using an insect repellent with DEET, wearing long sleeve light colored shirts, pants, and a hat, and ensuring that you don't go out at dusk and dawn when mosquitoes are most active.
What can you do around your home to reduce the risk of exposure to mosquitoes?
So around your home, you can make sure you have tight fitting screens on your doors and windows. If you have rain barrels outside, make sure it has a screen cover. And finally, ensuring that you don't let stagnant water stay standing for more than 7 days. And areas around your yard, you can check for stagnant water, can include saucers under the flower pots, fountains, pools, kids' wading pools, and uncovered trash cans.
That's excellent. Thank you, Zareena. We have more information available online on the website you see on our screen. Thank you again for all the great information, and we'll be right back with more Health Matters. Thank you for watching Health Matters today as we prepared for summer weather, trips to the beach, and how to avoid those pesky mosquitoes. Thank you again to Mariana, who taught us about marketing to children, Alan for information on beach water safety, and Zareena for helping us prepare and protect against mosquitoes and West Nile virus. If you would like more information on Alberta Health Services programs and services, please visit ahs.ca. I'm Kelly Morris. Thanks for watching AHS Health Matters.